A very good evening and a warm welcome to the news live on Rupavahini Channel I. I'm Sharama Screen News.
A very good evening indeed. I'm Charitha Prarachi, and now let's move on to the headlines for tonight's news.
Scholarship examination concludes successfully. All preparations made for the advanced level examination. 2 villages in Mena have been isolated. 7 villages in Bedrikama and Athanagala have been declared as high security zones. The Gazette notification consists of health guidelines to be issued within 2 days. An appeal to report news on COVID-infected patients in an ethical manner. Director of CID to appear before the Attorney General in connection to the release of Riyaj. Another international victory for Dilanta Malagamua.
On to those and other stories in detail now, and starting off with local stories. The Grade 5 scholarship examination was successfully conducted today amidst the COVID-19 outbreak. The examination was held within a special health protective process. A total of 331,694 candidates sat for this year's examination. Meanwhile, special examination centers were established for COVID-19 infected and quarantined students. This year, Grade 5 scholarship examination was conducted at 2,936 examination centers established across the country. Special methodologies were introduced to conduct the examination in the curfew-imposed police jurisdictions due to the COVID-19 threat. Under these methodologies, the opportunity was given to use the examination admission card as a curfew permit, and 11 examination centers were established in 18 police divisions. Even though the police public transport was not permitted to stop in the curfew-imposed areas, the public transport was allowed to be stopped in curfew-imposed areas, considering today as a special day. The Railway Department indicated that 2 compartments were allocated for the candidates of Grade 5 scholarship examination. A maximum of 20 candidates were allowed to occupy a classroom in an examination center. The police have indicated that a total of 7,000 police personnel were deployed for the security of the centers. The examination was commenced at 9:30 a.m. and concluded at 12:15 p.m. In the meantime, students currently being quarantined were also given the opportunity to sit for the examination in these centers. Meanwhile, Minister Professor G.L.P. is engaged in an observational tour at the D.S. Senanaik College in Colombo following the conclusion of the scholarship examination. Five COVID-19 infected students currently receiving treatments in National Infectious Disease Hospital in Angoda were able to sit for the examination, as necessary measures were taken to provide all relevant facilities within a proper setting for the students to face examination confidently. Necessary measures were taken to provide relevant facilities for 3 COVID-19 infected students receiving treatments at the Watupitivala Base Hospital to sit for the examination today. The students were taken to the Special Examination Center in an ambulance service.
You're watching the news on Rupavahini, and we're still on local news. The Ministry of Education says that all necessary preparations have been made for the GC Advanced Level examination scheduled to take place tomorrow. The examination will be conducted within a special health protective process due to the COVID-19 outbreak. 362,824 applicants are expected to sit for the GC Advanced Level Examination tomorrow. A total of 2,648 examination centres have been established, while 316 coordinating centres have been initiated at present. To confirm the identity of the candidate, the examination admission card along with the national identity card or valid passport or valid driving licence should be presented to sit for the examination. Department of Examinations has informed the candidates to check their examination admission cards thoroughly before entering the examination centres. Special examination centres have been established in curfew-imposed police jurisdiction due to the COVID-19 threat. The examination centre for the Ganimulla police jurisdiction has been established at Bulugahagoda Sri Vijay Mahavidyalaya. The examination centre for Yakkala, Gampa and Veeragula is Kappetipola Mahavidyalaya Miriswatta. The special examination centre for Kirindivela police jurisdiction established at Kirindivela Mahavidyalaya. The special examination centre for Valiveria and Malwatu Hiripitiya areas will be Valiveria Madhuma Bandara Mahavidyalaya. The examination centre for Dompe, Pugoda police jurisdiction has been established at CNA National School. Nittambo Buddhist College has been established as the special examination centre for Nittambo and Veyangoda police jurisdiction. The special examination centre for Meedigama and Pallevela is Siri Vidya Kirti Junior School, Kalelia. The special examination centre for Minuwangoda is Kotugoda Rahula Vidyalaya. The special examination centre for Divulapitiya area established at Divulagaha Ranasingha Mahavidyalaya. Mukalangamuwa Bandaranaika Mahavidyalaya Siduwa and Holy Rosary College in Dehiyagatta have been established at special examination centres for Jaila and Kandana respectively. Police spokesman DIG Ajit Rohana has said that the opportunity has been granted to use the examination admission card as a curfew permit.
පත්‍රයේ ඡායා පිටපතක් පුළුවන් නම් තබා ගන්න එමන් නැත්නම් ඉලෙක්ට්‍රොනික පිටපතක් තබා ගන්න අවශ්‍යතාවයක් වුණොත් ඒ එකම පොදු ප්‍රවාහන සේවා භාවිතා කිරීමේදී වැඩිපුර අවධානයක් යොමු කරන්න.
A special program was telecast on the national television last night for the students expected to sit for the Grade 5 scholarship examination and the GC advanced level examinations. Issuing pertaining to examinations were directed to the panel during the program.
And meanwhile, necessary facilities have been arranged for the public to access services of the Presidential Secretariat via telephone and post. This decision has been reached considering the health guidelines to suppress COVID-19 and to avoid any inconvenience caused on the public visiting the Presidential Secretariat. Accordingly, facilities have been arranged for the public to reach the Public Relations Division, Ombudsman Office and the President's Fund and the Presidential Secretariat. The Public Relations Division can be reached through 0114 354 550, 0112 354 550 and via fax on 0112 348 855. Ombudsman Office can be reached through 0112 338 073. President's Fund can be reached via 0112 354 354, extensions 4800, 4814, 4815 and 4818 and through the fax 0112 331 and 243.
Experts emphasize that the news reporting on COVID-19 patients should be carried out in accordance to media ethics. They make these comments while sharing their views on the national news reporting manner of several media institutions. The experts have pointed out that the most recent incident is related to the detention of the student at Sri Jayavarthanapura University as a COVID-19 patient. Several media have reported this incident in a manner of a criminal being taken into custody. Also, the visuals of the student were also used under headline news. The nation should realize that COVID-19 is a disease and not an offence committed by an individual. A patient infected with the COVID-19 being transported to a hospital is a step taken for the well-being of the patient and to curb a further spread to the society. Awareness made through media over the locations where patients have been identified is a social protective measure. However, it is not ethical for media personnel to chase behind an ambulance to capture a glimpse of the patient while being transported to the hospital. Such irrational media practices have been severely criticized on social media platforms. News reporting of the national television has always been exemplary, guiding others at the helm while safeguarding media ethics. The national television has comprehended the role in its field and will continue to report news to the public in fulfilling the national duty and not for mere entertainment. Therefore, the national television invites to rally together in assuring responsible media reporting in the country away from competitive attitude. Meanwhile, the Government Information Department has pointed out that in news reporting on people who currently infected with the COVID-19 virus subject to quarantine, it has been observed that certain electronic media broadcast illustrations that harm the privacy of individuals, such as the manner they are taken into quarantine or hospitalization and their homes or surroundings. In some cases, patients and associates are perceived as antisocial by some of the media, according to the Government Information Department. Telecasting of such scenes does not make an effective contribution to the proper awareness of people. Some people may not even seek treatment or quarantine due to the risk of socializing such scenes that harm their privacy. According to the Department of Government Information, there has been a great deal of public displeasure and protest against this negative use of media and disturbed the Special Social Commission of the Media to properly educate the public at this critical juncture. Accordingly, the Director General of the Government Information Department has requested the media not to record or telecast scenes which could harm the privacy and social dignity of those suspected of being infected with the COVID-19 or their associates. Meanwhile, the Chief Epidemiologist of the Health Ministry, Dr. Sudha Samaraveera, briefed on the prevailing situation in the country following the detection of a new cluster.
We have identified 46 close contacts of these factory workers as patients. There are 3 patients yet to identify to establish the connection to the Brandix company, and we are investigating on that. Now that we are identifying all the close contacts of these positive patients, and we are tracing them back and identifying and doing the PCR testing. We hope that in future that we will be encountering more and more cases among these contacts, but we think that we will be able to control this very well because that we have approached this cluster very proactively. We identified all the cases, almost all the cases within 2 or 3 days, and now that we are extending it to the tracing the contacts and identifying the patients among them. And also the contacts will be quarantined for 2 weeks, and we will be doing the PCR testing at right time to identify more and more cases among them. So at the moment that what the people can do to prevent this, to stay at home as much as possible, because that it is not only in Gampaha district that we are experiencing this COVID-19 cases that is related to Brandix company. Cases are reporting from different districts all over the country, but with a link to the Brandix company. So because of that, we request the people not to come to the society unnecessarily, be at home as much as possible, and also that if you are coming to the society, you should maintain your 1 meter distance all the time, whether it is on the street, whether it is during the transport, or whether it is in a supermarket or some other shop. As well as that when you are coming out, that you should wear a mask, face mask very properly, covering your nose and mouth, and also that you should wash your hand and clean your hand with soap and water. If soap and water is not available, you can use 70% alcohol containing solutions, and all the time that your hand should be clean. If you do these things, I think that we will be able to control this COVID-19 outbreak that happens in Minowangoda Brandix company very well within a short period of time, and the people will be able to return back to their normal life.
And meanwhile, Sri Lanka Army Commander Lieutenant General Shavendra Silva says that Petitottam and Perikade villages in Mana area have been isolated until further notice. Meanwhile, 7 Gramatilladhari divisions of Kurikotua, Maligatana and Eluapitiya areas under curfew imposed Berigama and Athanagala divisional secretariat divisions have been declared as high security zones. A total of 1,186 patients have been identified related to the Developity COVID-19 cluster. Thus far, 61 infected patients were identified today. Sri Lanka Army Commander Lieutenant General Shavendra Silva said that several COVID-19 infected patients were detected related to the Manor Bishop's house. He said that accordingly, a decision was reached to isolate Petitottam and Perikade areas in Manor to curb the further spread of the virus. 7 Grama divisions in Kurikattua, Maligatana and Eluapiti areas have been isolated after detecting 37 COVID-19 infected patients. Gampaha District Secretary Sunil Jalat said that 7 Grama divisions of Kurikattua, Maligatana and Eluapiti areas under curfew imposed Merigama and Attanagala Divisional Secretariat divisions were declared as high security zones as protective measures. Meanwhile, Minister Pavitravani Arachi mentioned that the Gazette notification consists of health guidelines will be issued within 2 days. Minister Pavitravani Arachi said that the Legal Draftsman Department has been directed to formulate the relevant legal draft. She said that after issuing the Gazette notification, court cases will be filed against those who violate the regulations with a maximum penalty of 6 months imprisonment. She said that such violators can be taken into custody without warrants. She added that wearing masks will be made compulsory and the maintenance of 1 meter distance.
සෞඛ්‍ය පුරුදු වලින් පැන නැගෙන කාරණා අපි නීතියක් බවට පත් කරන්න අපි කටයුතු කරනවා හෙට හෝ අනිද්දා.
An undergraduate in the Social Sciences faculty of the University of Kelaniya has been identified as a COVID-19 patient. Her father is an employee at the Banrix company. Two daughters of a COVID-19 infected employee at the Brandix company residing in Utugampala area have been tested positive for the disease. PCR tests were conducted on close contacts of the newly identified COVID-19 patients and 2 children infected with the disease in Galgadara area, which include more than 400 students. Severe congestions in hospital clinics pose a high risk in transmitting the COVID-19. As a solution, a program to distribute medicine to the residents of the patients will be commenced from next Tuesday. The Health Ministry has announced the plans have been made to initiate the program in Gampaha and Colombo districts and to implement an island-wide program. The curfew imposed in 18 police jurisdictions in Gampaha will be continued and the operations to apprehend curfew violators have been also commenced. Osasal and Satasa outlets will remain open in curfew-imposed areas, allowing the public to purchase essential commodities without any inconveniences.
Here's the COVID-19 update from around the world. The number of confirmed COVID-19 cases worldwide surpassed 37.5 million, while the death toll exceeded to 1.07 million. India has now reported more than 7 million coronavirus cases, while taking a step closer to overtaking the United States as the world's most infected country. The Americas remain the most affected, accounting for nearly half of the global tally, with the cumulative number of cases in Latin America surpassed the 10 million mark in the last 24 hours. Following the Americas are Southeast Asia and Europe, with more than 7.82 million and 6.8 million reported cases, respectively. The United States remains the worst-hit country in the world with the highest caseload and death toll. The nationwide caseload amounted to 7.94 million cases, approaching the 8 million mark, with the death toll reaching to 219,000. The number of new infections in the United States remains stubbornly high, with over 50,000 cases on a daily basis in the past 4 days, and a single-day death rise stands at about 700. India and Brazil are the second and third countries with the most cases, reporting 7 and over 5.09 million cases, with more than 108,000 and 150,000 fatalities, respectively. Adding 1 million cases in just 13 days, India passed the 7 million milestone after the country reported nearly 74,400 new infections in the last 24 hours, even as the spread moderated in the western states such as Maharashtra. Despite the coronavirus cases rising at an alarming rate in the country, the government pushed for reopening of all public transportation, including flights and trains, and also opened markets and other public places to bring its economy back on track, which suffered a tremendous downfall following the lockdown. The Central Regulatory Bank of the country, Reserve Bank of India, also projected the GDP growth at a negative 9.5% for the year 2020-2021. Brazil recorded 26,749 new infections and 559 more deaths in the last 24 hours, according to its health ministry on Saturday. So far, it has registered 5,082,637 cases of the virus since the outbreak, with the death toll reaching of 150,198. European countries are grappling with a second wave of coronavirus, and France is the worst hit with one new high daily infections of almost 27,000. France confirmed 26,896 new infections over the past 24 hours, a new record since the outbreak of epidemic. Country's COVID-19 tally stands at 718,873. The overall deaths linked to the virus is at 32,684. The United Kingdom had 15,000 positive tests in the past 24 hours, bringing its total to nearly 591,000, while the death toll is at 42,760. The country reported new cases about 10,000 for 8 consecutive days. Meanwhile, several European countries which were less severely hit by the first wave earlier this year are experiencing a fresh spike in the new COVID-19 cases. In the meantime, the International Monetary Fund has said that the economic damage as well as the health costs caused by the coronavirus has left Africa needing $1.2 trillion over the next 3 years. Africa has had fewer COVID infections and deaths than most other continents, but the World Bank has said that 43 million more Africans are at risk of extreme poverty as a result of the pandemic. The economic impact is reversing the trend in recent years of strong growth in Africa, as jobs have been lost and family incomes have been reduced by 12%. The IMF has given African countries about $26 billion to cushion the impact, but even with the help of the private lenders and other countries' assistance, there is still a huge shortfall in funding. More than 1.5 million confirmed coronavirus cases have been recorded in Africa, with nearly 37,000 deaths.
Welcome back with more local stories. Deputy Inspector General of Police in charge of Criminal Investigations Department and the Chief Investigating Officer have been ordered to appear before the Attorney General over the release of Riyaj Badruddin. The relevant documentation on this regard has also been requested to submit to the Attorney General. Brother of Rishad Badruddin, Riyaj Badruddin, was taken into custody on 14th April over the alleged connection to the Easter Sunday attacks. Riyaj Badruddin was released from the custody after the Criminal Investigation Department informed the court that the investigation conducted on him, who was in custody for more than 5 months, have been concluded. His release was received with protest from many parties. A petition signed by 100 MPs of the Sri Lanka Podujana Peramuna and presented to the President requesting for a proper investigation in this regard. Coordinating Secretary to the Attorney General State Counsel Nishara Jayaratne had said that the attention of the Attorney General has been directed to the release of Riyaj Badruddin. Coordinating Secretary of the Attorney General State Counsel Nishara Jayaratne said that evidence revealed from the investigations will be considered during the meeting with the relevant officers. She said that the Attorney General will inquire into the release of Riyaj Badruddin without the knowledge of supervision of the Attorney General. She also said that the Attorney General will direct attention on the facts which led to the withdrawal of the criminal charges against Riyaj Badruddin after he reacted the fundamental rights case filed with the Supreme Court and the habeas corpus filed with the Court of Appeal. She said that subsequently the Attorney General expected to instruct the relevant parties on suitable actions to be taken based on the evidence related to the case.
The Civil Defence Department has been tasked with the cleaning and maintenance of the sacred site of the historical Aukana Buddha statue. The task has been allocated with the department upon the instructions of President Gotabaya Rajapaksa. President Rajapaksa engaged in a tour at the sacred site of the historical Aukana Buddha statue recently. During the visit, Chief Incumbent of the sacred site, Venerable Shastravalliye Jinananda Thera, informed the President that the maintenance activities have not been conducted. At this occasion, the President instructed Director General of Civil Defence Department, retired Rear Admiral Ananda Peris, to carry out the maintenance and development processes of the sacred site under the Civil Defence Department. Accordingly, civil defence personnel of the Higher Training School of the Galkiriyagama Civil Defence Department cleaned the sacred site yesterday. Director General of the Civil Defence Department, retired Rear Admiral Ananda Peris, was also present at this occasion.
And on your sports update this evening, Sri Lankan racing champion Dilantha Malagamua has placed third in the Pro AM category of the Lamborghini Super Trophy 2020 Championship. The race was held in Spain. Fidel Leib managed to secure the first place in the category. International racing drivers representing many countries in the world are taking part in this championship.
Just about dry online, very, very soggy offline and on the curbing, and any driver who went wide paid the price. Number 14. The second of the Lamborghinis. A look back at the start, we started into the gravel and turn number 4 with the safety car leading the field in the face of Doran, buried in the gravel. Yeah, well done. One goes. Yellow lights, flat, and the gap came down to place overall.
And with that, we conclude tonight's news. Do it just tomorrow at the very same time. Stay safe. Good night.